When bacha came to you with nocturnal enuresis, always try to find out the psychological cause. Stress is one of the main triggering factor in nocturnal enuresis. That is most commonly seen in secondary enuresis. Children experience stress when moving to one home to another home. If parents are working in that place that they have to change the house, that might be the cause of stress in children. Even changing the school is one of the triggering factor for the stress of children. These are the very small things, guys. But when you find out, your medicine will work excellently. When parents are changing the home, when child is changing the school, and child is not able to adjust in new surrounding easily, the homeopathic remedy is Kali Phos. Simply think of Kali Phos in those cases, it helps a lot. Kali Phos you can give in 1 potency, or in some cases you can think of Kali Phos in biochemic potencies, in 6x potency. If you don't get any specific cause in some particular case, prescribe Kali Phos 6x 236x TDS. It works, guys. If you get such mental stress, changing the school, changing the home or house, you can think of in 1 potency. Experiences of parental divorce, or parents are not living together, they are separated, child is living with only one parent. I am a single parent mother. In those cases, you can think of Natramure. Parents are not loving me. Parents are not giving time to me. Child is seeking a love from parents. Nowadays, both the parents are working. Child is living with some nanny's house, or child is staying at boarding day. In those cases, nocturnal enuresis can be happen. That is the psychosomatic cause. And in psychosomatic cause, we all know homeopathic works excellently. If we know the cause, try to arrange some situation that child can prevent it. If the cause is divorce of the parents, explain them that might be the cause. So you have to arrange such condition that bacha get love from you. Try to maintain the maintaining cause, to avoid the maintaining cause. If someone is getting coughing from the cigarette, if it is maintaining cause of the coughing, then we have to avoid that maintaining cause. If child is going through major life events, for example, child is going to some school or some presentation in the school, or some, especially in female kid, someone is harassing them in school, some peon in the school is harassing the child. Guys, these are the common causes. Believe me, nowadays they are transporting to the school with the van, from the winger, from the school bus. The school bus driver is harassing him or her. That might be the cause of creating nocturnal enuresis. Try to find out. That stress can cause bedwetting. Even bully in the school. Some group of students are bullying that child in the school. some group of children are harassing them in the school, that might be the cause. Insulting in the school, guys, is one of the cause. What are the remedy? Ailments after insulting.
Staff is one of them.
Yes. Staphysagria is one of the remedy, and another remedy is stramonium. After insulting, if fear is the cause, we have remedy, that is stramonium. If child is suffering from fear, child is not able to go in another room which is dark. Child, if parents are living in duplex, child is not going to upstairs due to darkness. Fear of darkness is the cause. Think of stramonium. Ailment after stramonium. School में parents school में teachers call the child, and then after enuresis begins. That is the secondary enuresis. You can think of staphysagria. Try to find out the cause, especially in nocturnal enuresis. Even sleep apnea, snoring is one of the cause. That is the very rare cause. But bedwetting happens because a child has obstructive sleep apnea. Rare cause, लेकिन that might be the cause. So ask about that. आपके बच्चे का nasal blockage वगैरह रहता है, snoring रहता है. If child is sleeping constantly while talking in class, you can think of sleep apnea, especially in obese kids. Nowadays, obesity is one of the big issue in pediatric cases. When the child is very obese, the obstructive sleep apnea might be the cause. Partly blocked nasal way, that might be the cause. So nasal polyp might be the cause. So we have to treat nasal polyp if child is suffering from sleep, suffering from nocturnal enuresis. That can change the chemical balance in the brain, and that might be the triggering factor of bedwetting. As some doctor told, constipation. Yes, constipation is one of the cause. Bladder and bowel sits very near to each other, and backed up bowel or constipation can push on the bladder. That might be the cause. That cause the child to lose bladder control. जब भी constipation की वजह से bowels are remain full, and due to that it creates pressure on the bladder, and that might be the cause of nocturnal enuresis. Treating the constipation is often the first step to treat the bedwetting when the patient is suffering from constipation. If the child having pain or requires strain to pass the stool, that might be the cause, and that is one of the triggering factor which contribute in bedwetting. As I told you, bladder and kidney is one of the cause. This might be the cause if the child has both daytime and nighttime bladder control problem or other urinary system problem issues. Then urine frequency is there. We can think of the bladder issues or the kidney issues. Spinal injury or even any surgical thing can trigger the nocturnal enuresis. If I'm not wrong, the phrenic nerve is one of the cause. Due to that, if any issues in the phrenic nerve, that affects the bladder, and due to that, control of the bladder is loses. If the numbness, tingling sensation in lower limb along with the nocturnal enuresis, we can think of spinal cord cause, or the brain might be the cause. So the associated symptoms are required. Differentiate the cause. The other medical condition, that is diabetes in children. Even ADHD वाले बच्चे, attention deficiency child, attention deficient hyperactive disorder child, ADHD वाले बच्चे, in those cases, sometime enuresis might be might be the cause of enuresis. The ADHD causes chemical changes in the brain, and that might be the cause. If child or patient is under or some medication, so we have to think about that medicine that can affect the child enuresis or urination. That even UTI, as we already discussed, UTI, recurrent UTI, especially in female child, which is very common cause of nocturnal enuresis. क्या पेशेंट को क्या एक्सप्लेन करना है guys? This is the thing which is not able to explain by the parents very easily. Even in child is not expressing to the parents very easily, so that affects emotionally to the parents as well as child. It has an emotional impact in both children and their families. Children may get embarrassed feeling. What is the remedy for embarrassment?
Embragration.
Yes, the remedy is embragration. If you feel so, a patient having embarrassment feeling due to nocturnal enuresis, not every bacha having an embarrassment feeling. When you get such embarrassment feeling in some particular bacha, you can think of embragration. Feeling anxious due to enuresis, develops low self-esteem or low self-confidence. It can affect their relationship with the siblings. क्यों? क्योंकि वो बच्चे को अलग सुलाते हैं कई बार. They are not allowing child to sleep in the same bed. So that affects the relationship with other siblings. Quality of life is changed. Even school work, बच्चा रात को उठता है, उसको उठाना पड़ता है, and due to that consciousness or that concentration is reduced at the school timing. Children with bedwetting may feel like they cannot go to sleepover. Nowadays, pajama party is very common in children. Night out is very common in children. They just feel that separated from the group of people. What is the remedy? Separated feeling, forsaken feeling, abandoned feeling.
Makeup.
Yes, we can think of makeup when child is feeling such thing inside. Siblings may have to sleep in separate rooms and be woken up when the parent or bedwetting alarm wakes the affected child. Family members may have the extra work to cleaning the bed sheet and all the dirty sheets and clothes. So that is very difficult for parents also. When both the parents are working, they have to wake up 2 to 3 times at night. That is very tricky condition for them. वो 3 या 4 बार बच्चे को उठाते हैं, then they have to wake up at early morning and work for a whole day. Is quite difficult for parents. That affects emotionally to the parents. It is very important to remember that bedwetting is not child's fault. That is not under control of his or her. Family members explain the parents के किसी और के सामने never discuss such thing. That creates same feeling to the child. That and never punish for such condition to the child. That is not under control of child. Instead of that, focus on working with your doctor. हमारे पास लेके आओ. We are going to treat such child. Are you getting my point, guys? Any doubt till now?
No, sir.
Now, what the precautionary thing, or what are the tips you can say to the parents whose child is suffering from bedwetting? Anyone? Basic advice you give to your parent, to your child's parent?
We usually say to limit the intake of fluids 2 hours before bedtime.
Yeah.
There are also diapers available with alarm clocks. Not much of use, but theoretically पढ़ा था book में कि ऐसे alarm वाले diapers मिलते हैं. Then you can wake up the child every 2 to 3 hours depending upon the frequency at night.
One theory is that is alarm theory, but that is not practically works. Why? Causes that creates habit to the patient. Parents are putting alarm, 2 बजे उठाते हैं, 4 बजे उठाते हैं, along with that वो एक डायपर पहनाते हैं. So the diaper can create habit to the child. उससे अच्छा है ask the parents कि भाई एक अलार्म रखो, डायपर मत पहनाओ, हर 2 घंटे पे 3 घंटे पे बच्चे को उठाओ. That works in those kids who are not waking even after passing urine. जो बच्चे यूरिन पास करने के बाद भी नहीं उठते हैं, in those cases it works excellently. Are you getting my point? So alarm therapy works in those bacha who are lazy or you are not waking up even after passing urine. As you told, कि limit intake of food and drinks. रात को 8 बजे के बाद आप बच्चे का लिक्विड इंटेक एटलीस्ट कम कर दो, वाटर इंटेक कम करो. सी एक बार डेवलप हो गया, then बच्चा can take the water at night. There is not an issue. But now he is under the training. So in those phase, in that particular phase, बच्चा को वो इवनिंग टाइम के बाद वाटर इंटेक या लिक्विड इंटेक कम करवाओ. कैफीन का इंटेक कम करवाओ. Caffeine is one of the cause of creating enuresis in kids. Nowadays, coffee is very common in parents. तो पेरेंट्स के साथ साथ 5 साल का बच्चा भी रात को कॉफी पीता है. Due to that, caffeine can be the triggering factor in kids. Even you can advise the parents कि रात को जो नाश्ता होता है, स्नैक्स होते हैं, उसमें भी salty snacks मत करवाओ. That might be the affecting factor. Salt urine का frequency बढ़ाता है. Even sugar intake you can avoid to the child after evening. Especially जब आप sugar control करवाते हो, तो hyperactive बच्चों के अंदर भी evening के बाद sugar intake कम करवाओ. जो बच्चा पेरेंट्स बोलते हैं कि रात को मेरा बच्चा सोता ही नहीं है, वो 1 या 2 बजे तक सोता नहीं है. In those cases, you advise the parents to reduce the sugar intake after evening. Encourage the child. Parents को बोलो कि बच्चे को encourage करे to go to bathroom regularly during the daytime. At least every 2 hour or 3 hour. हर 2 घंटे पे या 3 घंटे पे यूरिन पास करने की एडवाइस दो या एनकरेज करो. And specially pass the urine before going to bed. Make a habit to pass the urine before going to bed. These are the very common advice. But guys, it works excellently when you give it to the parents. You can give another advice that wake your child only once during the night to urinate. कई पेरेंट्स 4 या 5 बार उठाते हैं बच्चे को. If it is required, रात को एक ही बार उठाओ. Waking a child more than once a night may disturb his sleep or her sleep. So that might be a triggering factor, which could lead to the problem at school on next day. तो बच्चे का नेक्स्ट डे स्कूल में बिगड़ेगा। आज द पेरेंट्स की रात को एक ही टाइम 2 बजे उठाओ, 3 बजे मिडनाइट को उठाओ। व्हेन चाइल्ड इज इन टीन एज, इन दोज केसेस उनको पजामा पार्टी में जाना है या स्लीप ओवर में जाना है या नाइट आउट करने जाना है या ओवरनाइट कैंप्स में जाना है, नाउअडेज इट इज वेरी कॉमन। तो बच्चा सेपरेटेड फीलिंग ना करे, आस्क हिम कि गो विथ अंडर पैंट्स, मतलब डायपर के साथ भेजो। कंसिडर योर चाइल्ड टू सेंड विथ डिस्पोजेबल डायपर, बॉक्सर के अंदर वो पहना के भेजो। And ask your child, parents को समझाओ, ask your child to ask about the urination to the host or the parents of that particular house, या कैंप काउंसलर को बात करो, कैंप में जा रहे हो तो, एंड उनको प्राइवेट में ऑलरेडी बात करके रखो if child is going for camping if needed. Are you with me, guys? These
Yes,
are
sir.
the guys. But guys, जब भी you give this such advice to the parents, parents can feel that you know much better than other doctors. So these are the common advice, लेकिन you just give to the parents.